Okay, welcome back. It's time now for our weekly check-in with infectious diseases specialist, Dr. Isaac Bogoch. Dr. Bogoch, good morning. Good to see you. So let's get into it. Hamilton's medical officer of health has declared the risk of contracting West Nile virus is high now after the first human case of the year was detected in the city. Previously, they had set that level to moderate. So what do you make of this now that the alert has been raised to high? What do people need to be aware of?
Yeah, I think it's important to remember that we have this every summer. We typically start to see human cases at the tail end, mid to tail end of the summer and into the early fall. And it's expected. This is when we see West Nile. It's a mosquito transmitted illness. And it's pretty easy to prevent. It just means you don't get bitten by mosquitoes by either wearing long sleeve shirt and long pants or putting on mosquito repellent. Pretty straightforward stuff. But, it's also important to remember, too, that West Nile virus the vast majority of people that get this infection actually have no symptoms. About 75% of people don't have any symptoms. The majority of people who have symptoms will feel a little crummy for a few days: fever, headache, muscle aches and pains, fatigue, but it gets better on its own. Only rarely, fortunately, very, very rarely, there can be neurologic manifestations. And sometimes that can be severe. It can include inflammation of the brain, inflammation of the spinal cord, and even a paralysis-like syndrome. It is extraordinarily rare. It does happen. It's extraordinarily rare. And like I mentioned before, the best thing we can do is prevent mosquito bites, because the mosquitoes can transmit it around this time of year with long sleeve shirt, long pants, and bug spray.
Yeah, that bug spray is certainly my friend. Mosquitoes love me. Dr. Bogoch, hate to admit it, but the weather is starting to change now, which means fall and back to school are just around the corner. What are you watching for this season in terms of infectious diseases or illnesses as kids and students congregate once again in classrooms in closed settings after summer travel and summer camp this season?
Yeah, I mean, as you point out, it's coming up to the time of the year where we have to start thinking about when respiratory viral infections start to rise. COVID over the last few years started to, we saw rates go up around the mid to late summer, and they're probably starting to do that now. Although if we look at the COVID rates this year compared to, for example, the last 2 years, they are lower. And then, of course, later into the fall, we'll see influenza and respiratory syncytial virus. Now, last year had a pretty significant flu season. Influenza was, when we look at most metrics in terms of hospitalizations and deaths and morbidity associated with influenza, last year was a pretty rough season. We will see those vaccines roll out a little bit later into in the fall. So stay tuned for updated vaccines for those. But I mean, I think if people are wondering what it's going to look like, I'll tell you, it's not going to look like 2020 or 2021.
Right.
It's probably going to more closely resemble what the last couple of years have looked like.
Okay, that is, I guess, better news than we've seen before. And you tweeted about this, or wrote on X, I should say, Rocky Mountain spotted fever. I read this and I thought, oh, this is chocolate, but this is an uncommon but very serious tick-borne infection. And a case has been found in Quebec, also somewhere in Ontario earlier this year. So what are the symptoms of it and the treatment for it? And are we almost kind of done with tick season now that summer is coming to an end?
So interestingly, the ticks will be around for a while until it gets really cold. And of course, they can bite and they can transmit illnesses. Now, most people know about Lyme, but there's other tick-transmitted illnesses. And as we have shorter winters and less cold winters, these ticks can survive and thrive in more northern latitudes. And we are starting to see infections that we are typically found farther south than us that are now found in Canada, including Rocky Mountain spotted fever. Fortunately, it's rare, but it's a very serious illness after a particular type of tick bite. It's been identified in a human in Quebec. It's been identified in dogs in very southernmost part of Ontario, but it's going to be around. And, the treatment is an antibiotic. It's doxycycline, which is widely available. The key thing here is recognizing that it's around, reducing the risk of tick bites with insect repellent, and informing frontline healthcare providers, clinicians and public health specialists that we do have emerging tick-transmitted illnesses in Canada. We should be aware of them so that we can prevent them. And if we do have them here, we can detect them early and start people on treatment early. This particular one can be very severe.
Okay, Dr. Bogoch, that is our time for this morning. As always, appreciate your time. Have a great week, and we'll chat again soon. Take care.